Hi, good day. My name is Keisha Rawlins from Kare Nursing Agency. Today we're going to be talking about foot pain. This topic is very dear to my heart, and so you'll learn a little bit later on. First, we'll talk about diagnoses. Foot pain, to have a diagnosis, it's important. It's all about working out what is causing your pain so that you know how to treat it effectively. One of the simplest ways to approach foot pain diagnosis is to start by thinking where exactly the pain is. From there, you can hone in on specific symptoms to work out what is causing your pain. There might be a problem in the bones, inflammation in the tendons, or damage to one of the ligaments. There are over 100 muscles, tendons, bones, and ligaments in the foot. So here we have countless of things that can go wrong. First, we want to talk about pain at the top of the foot. Right here. Pain at the top of the foot or across the front is a common problem. Strain on the muscles, tendons, and bones from overuse can lead to inflammation or degeneration, leading to tendinitis or even fractures. Right across here, you can have what you call stress fractures in this area where the bone is. We'll now talk about pain at the bottom or arch of the foot, right under here, where the arch is, right here. Pain under your foot is common if you spend a lot of time on your feet. There may be weaknesses or tightness in the muscles of the foot, or the arch may not sit correctly. They may mean that the foot isn't supported properly, leading to pain. Poor feet hygiene also causes problems under the foot. Then we're going to talk about pain to the side. That's right here by your ankle area. Pain on the side of the foot is usually caused by overuse, injury, wear and tear, or bone deformity. An ankle sprain may typically cause pain and swelling on the outer side of the foot. Pain on the inner side of the foot is often due to flat foot arches. That's where the foot doesn't have this nice supportive arch. It's flat. It doesn't have that arch. You see this arch? So that's how you get pain, usually in this area here. The next pain we'll feel is pain in the heel. Our heel absorb most of the impact when we walk, so heel pain is a common problem. Pain at the back of the heel may be from tendinitis, bursitis, or bone damage. Pain underneath the heel is usually from plantar fascia, which is under here, or bone spurs. So you can have plantar fascia and bone spurs under here, and tendinitis in this area here. That's the back of the heel. We're now going to talk about toe pain. Problems can develop in any type of toe, any one of your toes. But most commonly, it's the big toe that's usually affected. Bone deformity is a common problem leading to bunions or bent toes. Toes may be damaged in sports or inflamed from conditions such as gout and arthritis. So as you can see, this toe, it's on the side a bit, and sometimes it gets a little bunion right in the corner right there. Even with this one, you can get a bunion right here, this area right here, and that is extremely painful. Then one other type of pain we can have is nerve pain. Nerve pains tend to be generally all over the feet. All over the feet. It's the nerve. You'll see this a lot in diabetics. All over the feet. Then The nerve damages are often frequent and it causes burning, pins and needles, numbness, weakness in the feet. The nerve may be damaged somewhere between the lower back and the toes. Symptoms may be in both feet as well. Calf pain, that's anywhere up your legs as you go up, are linked to Achilles tendons, so foot and calf problems can also go together. Damage to the calf muscle may cause foot pain, and also altered foot biomechanicals such as the flat feet can cause calf pain. Calf pain can also indicate vascular or neurological problems, so it should be taken seriously. Where is your pain? Pain can often radiate to more than one part of the foot, which can make foot pain diagnosis tricky. But start by thinking where your biggest area of pain is or where it started and go from there. Why is foot pain diagnosis so important? Acute and accurate foot pain diagnosis is an important part of treatment and recovery from foot and ankle pain. Without it, treatment tends to be general rather than specific, targeted to your problems, and whilst your foot pain may settle down in the short term, it is likely to return at some point. Let me give you an example. You have pain in your foot, so you rest it, you ice it for a few days. Take some painkillers, ease off of exercising. After a few weeks, it feels better, so you go back to your usual activities, but the pain returns. Because you never found out why it started to cause pain in the first place, you didn't make an accurate foot pain diagnosis with your doctor. In fact, you probably never saw the doctor. Example, muscle imbalance or altered foot biomechanics, and you didn't need to treat it because you didn't know you needed to treat it. Exercises and shoes can cause worsened pain and damages. Effective treatment of any foot problem relies not on simply treating the symptoms of the problem, example, instability or pain at the site, but at treating the underlying cause of the problem, example, muscle imbalance or flat feet. Seeing your doctor. Accurate foot pain diagnosis is best done when your doctor, your orthopedic specialist, will start by assessing. You should have these pointers or notes ready for when you go to the doctor. When and how the pain started. What other symptoms you may have along with that pain. What activities that you do aggravate or worsen your symptoms. Anything that helps to ease your symptoms, what are they? If you've had any previous injuries before, like a broken ankle, a bad sprain, and when. If there's any daily pattern to your foot, whether things are getting better or worse or staying the same. Any treatments that you have tried, and about any medication or condition that you may have, or any medication that you are presently taking. After this, the doctor will examine your feet, comparing left and right, and looking for any abnormalities such as swelling, redness, or bruising. The doctor will also want to take a look at your knees and back, particularly if they suspect it to be nerve involvement. They will also look at the movement of your foot and ankles, as well as the strength and flexibility of your muscles. They may also perform some special tests to assess the integrity of the ligaments and other structures if they suspect a bony injury, or you will have to go for X-ray, ultrasound, and in some cases an MRI. They may also order blood tests, and you may have to have a CT scan. Once you have given your foot pain diagnosis, you will now be advised how to self-manage your pain or be sent to a specialist or therapist depending on the situation. Now guys, this topic is important for me because I have been suffering from foot pain. The tricky thing is that it's not surprising that many people have foot pain. I now know that. But in my mind, my pain was contributed because I was always on my feet. I'm a nurse. But I further went on to assess myself to the point where I dismissed the pain, actually taking the pain for granted at this point, living with it, so to speak, adapting to the special situations as I go, not being able to wear the type of shoes I want because I was restricted because of the discomfort. I resorted to using one pair of shoes most times so as to eliminate or alleviate or relieve the pain. I did not know or didn't think for a minute that anything was significantly wrong. That is why I'm here today, to bring awareness personally and professionally to this situation. As you see, there are many types of pain: calf pain, nerve pain, side of foot pain, bottom pain, toe pain, top of the feet pain, heel pain. Many of the pains are both together or isolated. In my situation, my pain was at the back of my lower calf. Sometimes my calf, but basically my lower calf. It transcended under the ball of the heel. I didn't realize I had so many problems with my feet. Because I had calf pain, I immediately thought as a nurse that I need to have a Doppler ultrasound, which would tell me if I have any blood clots, because as you're older and obese, you are prone. And nurses, policemen, firemen, people who are in jobs that they are either constantly on their feet or not so much on their feet, but behind the desk, we have problems with people with the calf being warm to touch and painful and swollen. So I immediately thought, over the years, I think I've had 4 Doppler ultrasounds to determine if I have any blood clots in this area, and none of the times it showed any blood clot. So I had a reason to seek professional advice, but after that panned out fine, I continued on in the pain. So the source of the pain was never found, but I now know I didn't have any blood clots in the calf. The pain continued to such a point that ball of the heel that's on the here, it became so bad at times I could not walk in terms of getting out of bed and just going to the shower. I had to wait a while, like 5 to 10 minutes, because the digging sensation that was under this eventually whole feet, I swear my feet wasn't mine anymore. And then I realized when I put pressure on the heel, which is the back in this area, it was the pain was significantly greater. When I flexed my foot like that, I realized the back of the feet here was really bothersome. So I adapted myself to one pair of shoes that I thought was most comfortable of all. And I practice foot care because I really believe that it's a big deal. And in my professional life, I decided, okay, I'm going to take care of my feet if I'm going to educate persons on taking care of theirs. So I started making sure that I have foot soaks, and I will go to different facilities to have my feet nicely massaged, but they use hot water. I didn't know at the time that I should have been using ice. In terms of coldness, certain illnesses or certain conditions of the feet require not heat but cold, and most of us, if we don't know the difference, we wouldn't know what to do. At the end of a long day, my feet would swell significantly. In fact, I recall several times at work, I would take my foot out of my shoe and it would be impossible for me to put it back in. Why? Because it was so swollen and painful and tender and discomfort, no comfort whatsoever. Even if the shoe was the best and I bought the best, I realized, yes, something was wrong. But again, I dismissed it, thinking, okay, the rest of my feet is fine, it's just my mind. The tops of my feet hurt sometimes. When you have on your shoes, it's expected. So the discomfort there is regular. It's nothing to be worried about. I developed a bunion, but I knew that was something common and nothing to be too serious. I said, okay. Along the way, along the journey, I've been dismissing all my pain. One of the things I said to myself to make myself feel like there was nothing wrong, even though I was a health professional, even though I am still a health professional, I kept diffusing the situation and saying I'm overweight, and that should be one of the contributing factor as to why I'm feeling this way. Again, I was wrong. I started having pain more and more, and I felt like I should always wear this one shoe, as I said. That was something that should have been a red flag, but it really wasn't. I was doing all the rest things to help my feet. I was putting the mirror to the bottom of on the surface below and putting my feet over so I can get a look at it, because this is something that we teach diabetics to do, and I encourage everyone to do that, whether you have diabetes or not. So I was doing that all along. I was making sure I clean between my toes and drying them, because people have a shower and forget to dry between the toes, and it gets really bad and people can develop fungus. So I was making sure that doesn't happen to me. As I said, I was making sure my toenails are cut so that I don't have any ingrowing toenails. I've had like 3 over my lifetime already, and it's not a nice feeling. So of course you make sure you trim those toes, especially the big toe. Nothing else was wrong. I did what I can in my capacity. That's what I thought. But the one thing I didn't check for, or I didn't take seriously enough, was the pain. And we tend to do that. We tend to not take pain for what it really is. We dismiss it, we excuse it, we throw it away, literally. And that's what I did. January of this year, I was just not feeling myself. I went to the doctors because I felt like I needed to see someone. I actually went to the doctor because my blood pressure was elevated at that point, and I know I was doing a lot. I know I was very busy, both professionally and personally, and I just said something is amiss, but I probably need rest. But it wasn't just the rest that I thought that I needed. I needed to seek medical advice, because when you're medically inclined, you tend to diagnose yourself, and I was very guilty of that. So I said, I'm gonna go and see what doctor says. I didn't say why I came to the doctor at all. I didn't indicate to the doctor that yes, I had a rough night at work and I wasn't feeling well, and I just came for a general checkup on my blood pressure. I didn't mention anything about my blood pressure at that time. I just left it as is. I had a little nap before I went to the doctor, and I was right in his office and comfortable, and he discovered that the pressure was high indeed. I didn't say yes, I knew. I even pretended that I didn't know, but I very well knew from the day before. I was stunned. I said, after all this rest and taking the medication, it is still high? And I said, okay, because I now know that I wasn't crazy. I needed to see the doctor. He proceeded to put me on leave, which I wasn't really happy about, but I took anyway, because I recognized that the body does need rest, and the mind. And I said, to get this blood pressure down, I would need to take action, not just physically, but mentally. So I decided a break is really needed at this point, even though I reluctantly took it. I kid you not, by the 3rd day into this break was such a significant break, because it means I won't be functioning at all, professionally or personally. It meant that I had to stay put, and I don't usually do that. It meant that I had to not do anything at all, but just lie in bed, have a shower, eat, back to bed again, because that's how it was supposed to be. I wasn't doing that before. So for me to do that at that point, I didn't want to, but I was forced to, because I know the seriousness of hypertension. And because I know that, and I too have brought awareness to hypertension, I don't want to be a statistic. I knew I needed to rest totally, mind and body. I did. By the 3rd day, I couldn't walk. I woke up to go to the bathroom and I could not walk. I tried stepping off the bed and I almost fell. I realized I was gonna fall, so I grabbed hold of the bed, pillow, whatever it is that was there. I held on for dear breath because I don't want to fall. Now, at this point, I couldn't understand why my feet was not cooperating with my brain, because we know that our brain gets the message to move. Before I move my hands, my brain already received the message long before I said it in my intellect. So it happens. That's how wonderful we are made. And I'm realizing now that I cannot stand up. I have to hold on, pull myself up. So then I immediately panicked because flight or fright. I was scared. I couldn't run and go anywhere, but I was scared. For the first 5 minutes, I said, no, this can't be happening. No. This can't be happening. I proceeded to call my loved one, and of course it was early, no one was up, and it didn't hear me. I had my phone close by. I called on the phone, and because it was early, no one heard me. I continued to be scared for another 5 minutes. I can say 5 minutes now as I look and think back, but it was really like a whole eternity because no one is responding. Even they're in the same house, and I can't help myself at this point. I wasn't in any pain until I tried to step off. When I stepped off, I realized I really cannot walk. My whole world came crashing down. I realized that all of the things I didn't get to do, I'm thinking about it at that moment. Like, really? Why would you even think about it at that moment? But I did. I thought about, oh my God, I have a presentation to do on stroke. I have this. I was literally thinking of all the things that I had planned for Kare Nursing Agency. My personal life flashed before me as well. What if? And I could not make it to that bathroom. I went on the floor and I crawled. And all this time, I wasn't feeling any pain, so I thought. But the pain was there, but I was thinking of so many things, I didn't register the pain. I was focused on everything as usual, without focusing on what's happening, literally. By the time I crawled to get to the restroom, the pain hit me. I didn't walk, but the pain was there. And I realized the pain is not no different to the pain I usually feel. So why am I not on my feet? I can't tell you the rest of the story right there. I will say to you that I had to get help to use the bathroom. And when you're in that situation where you have to have someone help you just to use the restroom, it's degrading, dehumanizing. It's a lot of things that you never could have imagined until you're in that situation. Even if it's your loved one is who helping you. Could imagine how patients feel who don't know you at all, and you just enter their room or see you for the first time. You're the nurse, you're the caregiver, and you have to use the bathroom and they have to assist you every step of the way. It takes away something from you if that person is not nice to you, you know? And it reminded me instantly of patients who have nursed, who say, Lord knows, thank you. I never know how that thank you could resonate until I was that patient now, saying thank you, because I was so ashamed. For that 5 minutes, that I could not do anything for myself. I said, something is wrong. It took that time, 3 days into January, 10 minutes trying to get to a bathroom on the floor, trying to get help, finally get help, and feeling dehumanized for me to know something is wrong. Listening audience, TV viewers, don't wait to realize when you're in that situation something is wrong, or when you can't ever move again. That's why I'm here, to bring awareness to you, because it's a big deal. I took every pain, every time, every moment, every opportunity for granted, because something else was always more important. Even in my situation, that first 10 minutes, I am thinking about Kare Nursing Agency, what I have planned. Why? I can't execute a lot of these things if I don't have my feet. But I am thinking about everything else, what I would not be able to do. And sometimes that's the problem. The biggest problem was that everything else took priority except dealing with the problem in front of me, which was continuous pain. I proceeded to call the doctor that put me on leave. He asked me to go to Hendrickson, Dr. Dwayne Hendrickson. He told me in that first instance, before I was home, to see that specialist. Why did he tell me that at that point? Because when he examined me holistically, he touched my feet. At some point, I felt so much pain from a mere touch. He said, why are you having pain there? How long? I said, oh, it's nothing. I'm overweight. It's a regular thing. I'm always on my feet. I dismissed it, even with the doctor. You ever had a situation where you are a professional and you're dismissing a situation for yourself because you think it's no big deal, right? That's what happened. But the doctor wasn't having it. He listened, yeah. He said, listen to me. I would like you to see Dr. Hendrickson, please. I said, okay, knowing fully well I was not going to Dr. Hendrickson. I don't have a problem. Why am I going to go to Dr. Hendrickson? You don't put me on leave. What more leave I want? I'm staying home. I'm going to do what you say. For once, I'm going to do what the doctor says. So when I called, he said, remember, I told you. I said, I know. I'm going to go. I couldn't even go at first. I had to wait another 2 days to be comfortable enough for someone to assist me to the doctors. At that point, I'm limping because the pain is becoming unbearable. At one point, I was questioning my sanity. Is this real? Am I really feeling this? Why am I feeling this? Why am I even going to this at this point? I'm not on sick leave for my foot. I'm on sick leave for my blood pressure. I couldn't understand it. I was trying to sift it out. I didn't even know how to separate being a professional from being normal, because I was mixing up the two. And somewhere along in there, something went wrong. I was overwhelmed. I had so many questions. I didn't know who to ask. I spoke to God. I was questioning him, and I didn't know what he would say. And when I went to doctor, I was free to tell him how I felt. And he examined me. He asked me all the things that I listed. I list them because these are questions that would need to be asked. So you have to have answers. So as to don't waste any time. How did this pain start? When? What symptoms do you have? What aggravated it? Anything helps anything eases the pain? Any injuries before? I had broken my ankle before. He was my previous doctor. What pattern do you see? I was wearing the same shoes for months because I could not wear anything else that was more comfortable. Is it getting better or worse? Well, obviously it's getting worse if I can't walk. I had answers because I now realize I had a problem. It took that for me to know. Ladies and gentlemen, boys and girls, you don't need to wait till you're in a situation. We have plenty, we have said it. The side pain to the side of the foot, pain to the bottom of the foot where the arch is, right in here. That little arch you see here. The heel, right here. Under the foot, the whole foot. If you're diabetic, you will probably feel those pins and needles under there because of the nerve. The nerves are damaged in the diabetic foot. So you will feel it throughout the whole foot. You will even feel it sometimes and squeeze up your foot because you ain't even know it too tight because of the lack of blood supply. The toe. We have pain in the toes. You have to recognize if this shoe was too tight or if it was a regular shoe. Why your toe hurting you? Is it a bunion on the side? As we used to call them, the corn? Is it that? You have to know. You have to recognize when they start, when I first start. How would you know if you're not looking at the feet? You have to look at the feet to know. And that's another thing. We don't look at the feet. Dr. Woodley is passionate about foot care. But we're not just doing foot care for the elderly. We are doing foot care for everyone. We have to bring awareness about the foot. But we dismiss the foot. Sometimes we well dressed and we foot horrible. Sometimes we well dressed, we heel all crack up. You have a pain in so much areas. The top, right across here, you could get a stress fracture. You could have a fracture across here. It has nothing to do with issue sometimes. I mean, have everything to do with you and your daily activities. How would we know? To know is to search yourself, look at the condition you're in, touch, feel, probe. Even if you have to use a magnifying glass, you might have no breaks in the skin. The foot might be nice and clean. I use a clear foot for demonstration. So if any ailments was there, you would have noticed. Now, some of you have darker skin. If you start to pay attention, you will start to see things you never saw before. So you'll know when something changed. And that's the key. Things change, but we don't recognize it for what it is. Stop diagnosing yourself. I had to learn that. Stop dismissing, because my diagnosis never led to anything. It was all dismissal at the end of the day, but it was not helping me. Hendrickson proceeded to send me for x-rays. He proceeded to send me for ultrasound. He wasn't satisfied. In fact, the person who did my ultrasound said to me, she was speaking to some students who was there, I was so devastated when I heard if this client should have a sudden fall, her tendons could burst, rupture. I was so frightened, I wanted to run. That's the flight task. I was scared and I wanted to bolt. How could she say that? Wow, like really? And after I spoke to her, it was just what she thought based on what she saw. I said, is it that bad? She said, yes. Something is only bad and then you don't do anything about it, it gets worse and you are affected. But this bad, how long? I wouldn't have known. I was very tearful. I was going to see someone at the hospital at the time. I still went, but I was in the corridors bawling. Literally, I'm not a person that is without emotion. I am very emotional, but I felt, wow, what am I going to do now? What does this mean? I became that patient who suddenly don't know anything about medicine anymore. I don't know anything about anything. I'm just feeling how I'm feeling. I recovered my composure. I visited and I left, went home and I started to research. Spoke with my doctor at length and we both decided, let me go and see if there's anything else I need to find out. anything else before I do anything else, because of course I went to therapy. That was something that was time consuming, of course, painful, necessary though. I decided I was going to do the right thing, follow doctor's advice to RICE. It's an acronym we use in medicine. Rest the foot, R. You're going to ice it up, not heat, ice. We're going to compress, meaning use a compressed bandage to keep the foot just supportive. And then we're going to elevate that foot to keep it at a level so that you don't get swollen, because I was experiencing swelling at the end of the day. The swelling was contributed to the work I do because I am a nurse. I'm always on my feet. But again, as nurses, this happens to you, and it's just because your feet are tired. It might mean nothing, but you have to rest the foot, elevate the foot, put it onto pillows, or get a special cushion. If you're sitting at a desk, get a little step up to put your foot on. No matter the type of job, once you're gonna be sitting, you need to elevate your foot a bit. If you're gonna be always on your foot, you have to rest the foot. And when night comes, put it up. I knew that, but I wasn't doing it every time because there were other problems and I didn't know. So, after collaboration with my doctor, I decided I'm not gonna take this sitting down anymore. I'm going to take the bull by the horn. Now, when you decide to take the bull by the horn, it means you're putting yourself first. And it can be a daunting experience when you don't accustom to. But I did, and it was an enlightenment. It was a journey, actually, because you lose as you go. You spend money that you didn't know you have, that you didn't know you could ever find. You go to doctor's appointments, go to have tests done. It's a journey. I have been on that journey for about 4 months. And I can say my doctor here in St. Kitts, Dr. Dwayne Hendrickson, and my doctor in the United States, Mr. Robert Mills, they have both collaborated in an effort for me to be the best me possible, whether it's a nurse, being a mom, being the owner of Kare Nursing Agency. I have come to realize that along the journey, I could not be successful if I didn't have an open mind. I wanted to adapt to the changes that were necessary immediately, but some things have to go on you because you have to change your lifestyle. I practically have to change all my shoes. I have to now be a sneaker girl. Why? Because one of the things I had to do beside a small procedure, and a bigger procedure is planned, but that takes time, effort, money, and another collaborative effort. But in the meantime, you do smaller procedures to help alleviate the pain. The pain came from many sources. Chronic tendinitis, Achilles tendinitis, plantar fascia, right here. The same ball pain that you thought were nothing, oh, it's just, you know, bone spur, inflammation, built up over the years, wear and tear the foot because you're always on it. You lie at night, you rest the foot, yes, but as soon as morning, you tear away those healed tendons and ligaments, you tear them all away again because the constant pressure and weight bearing down on your feet, it becomes a progressive thing. You can't step off anymore without waiting and dangling your feet, and according to the doctor, do a little stretch exercises to loosen up those tendons that are so tight. And of course we're aging. So with all these ailments, as you age, it becomes worse. And that's another thing, because we don't check on ourselves prior to. When we are younger, we leave things undone. And then they step on over into old age. And we think, oh, it's normal to have that. It's normal for her to have a back pain, she old. No. It's normal to have foot pain, she old. Sometimes these pain, you don't see somebody 80 and don't have anything. They probably just have the common cold. Why? They didn't have no ailments like that because they were fine. But you who came over into old age with these ailments, and we think that old age is to blame. Bear in mind, the body slows down, we know that, but we are the ones who have this body now. And if we don't take care of this body right in the now, when we step over into old age, ain't gonna be no better. Because we're gonna make it worse. We're gonna make our 50s and 60s look like nightmares. And people out there living 80s and 90s in their best life. So why are we having to suffer at such a young age when we could do better? First, you have to know better. So that's why I'm here bringing awareness. Dr. Woodley will follow up with foot care, of course. And Dr. Hendrickson will talk about the bony structure, the skeletal part of this journey. Because I'm showing you just the little ailments you can have. Bunions, tendinitis, bone spur, metatarsal plantar fascia. All these things are there. And they are normal sometimes in the sense that it's because of how you live, these conditions develop. Because of the type of shoes you wear, these conditions develop. Because of the wear and tear, depending on your activities, if you're athletic, if you're somebody that is always on the go, don't have proper shoes, these things can occur. The constant wear and tear of the type of job you're in, a nurse, a policeman, a fireman, somebody who is always constantly going. But guess what? At some point you're gonna stop. Why are we stopping? Because something else popped up and then we're realizing that this problem is chronic. This is a chronic situation. Only realized when I was slowed down. I'm not usually slowed down unless I'm sleeping, and that's 4 hours tops, you know. So to slow down for 3 days, you know how much hours that? So that's not normal for me. So right there and then, it made the situation be more highlighted than ever before. Thank God for that. Another thing I was really on this journey was so interesting to me to find out is that the blood pressure was always elevated, probably always out of control. When I do check it, it's always out of control. Even I do what I'm supposed to do because the pain was always there. So the pain helps create that atmosphere for discomfort. So the blood pressure was never stable for any length of time because of the pain from the feet. Sometimes we have high blood pressure, it's pain we got. It's pain way up and it wouldn't go down. Sometimes all the medication in the world would not take your blood pressure down until you sort out what is really bothering you. Whether it's psychologically, physically, emotionally, once you have any type of pain and you don't fix the source, then your blood pressure is not going to be in control. It took that for me to realize that's why my blood pressure wasn't in control. So there's so many things along the journey that I've realized. And I said, no, I have to bring awareness. I have to bring awareness to the fact that we are taking our feet for granted. Dr. Woodley have been saying it many times, but this is from a perspective of a person who have had and still dealing with a situation that could have rendered me disabled. I'm at the point where I have to use 2 custom-made braces every day of my life except to sleep, so that I can have the quality of life that everybody who outside on the outside have. Could you believe that? And I have to wear something that costs over 2,000 US to accommodate me. Really no. I can do so much for the elderly with that type of money. But because I have to. The weight is a factor as well. I have to now be on that serious journey to lose weight, to make it a little easier on the feet because the feet is carrying all this weight. And before this journey, knowing what's happening. I was on the journey of going to the gym. I now have to go back to the gym with a new perspective. I can't do a lot of things anymore. In fact, I was told that some of the things I was doing made the situation worse because I didn't know there was a problem. So sometimes when I go to the gym, after I'm done, I feel like I can't walk because I do too much, and it wasn't right for what's happening with my feet at the time. But I didn't know. So I have to probably do upper body stuff because I can't do the below body stuff right now. I'm still limited in the things I can do. It's not a good feeling. It's actually very disturbing. And I'm upset. I forgave myself, but I'm upset that I did not use my professional skills to hone in on the fact that I had plenty red flags. But because it's me, I dismissed it. Had someone come and told me about their feet, I would have sent them straight to the doctor. But because it's myself, I walk out. I'm good. We need to take light of what's happening with us. We need to pay attention to the feet. Remember, we have toe pains. Look between your toes. Search. Make sure there's no fungus or anything between the toes. Look with a magnifying glass. Clean and dry between the toes. Look at your bunions if you have any. Look to see if they're really, because a bunion could develop into a sore. So you can't just say it's a bunion, is normal. Normal meaning and nothing wrong with the foot at all. So if you have any ailment, see a doctor right away. Don't wait. Look at the top of the feet. See if you touch and you probe. See if any pain. If any pain is there, well, you know that ain't normal. Go fast. Don't even wait another day. Go. Look at the arch of your foot. Press the bone on the heel. Just examine it. If you don't want to, you can always come to us at Kare Nursing Agency. Because once we see anything is wrong, we'll direct you to the right person. Whether it's a surgeon, the orthopedic specialist. Because the point is, you won't know if you don't check. We have pain to the back. My pain radiates from my calf, come down to under. Because I have calf pain now because of the associated tendon tears and stuff going on here. And then as I come down under the foot, right under here, where the bone spurs are and the plantar fascia are, is worse. Some days I don't know even how to think to move. I have to think before I move. Because it would be sharp, instant pain. And sometimes the pain is not anywhere there. It's in the general bottom of the foot. Sometimes nerve damage or diabetics. So you have to check the feet. When you already go to a professional, you could seek help from the orthopedic specialist as well. Don't wait until the blood pressure is out of control or you can't walk to realize that you need help. The help is now. You know there's something wrong. Those of you who right now listening and watching, you realize that something is wrong, and now you're realizing that, oh my God, I have to do something about it. Please, I'm asking you to. It's not cheap dealing with foot care when it's already a problem is there. It's much cheaper to know what's happening, check it out, and sort out yourself than to deal with it after the fact. A specialist don't come cheap. Why deal with things that you can deal with prior to? Don't wake up a morning and can't walk and suddenly become disabled, you can't work, you have to be laid up in bed and your brain ticking because you're active, but your feet can't carry nowhere. No. Please, I'm asking you guys to pay attention to your feet. Search your foot. Let somebody look at it, see if anything is in there that you don't even know there, and see if anything is paining you, or if something things in there and you ain't knock, it don't hurt. Let somebody look under your feet with a light and check all come up by your calf. If a problem there or ain't there, check it out. When you get an answer, you still have the discomfort, go back again. Ask for ultrasound. Ask for x-ray. Your doctor will work with you if you communicate. Have your questions ready so you can ask the doctor. Have everything prepared, the list of questions I gave you before, have it ready. Let doctor examine your feet. You examine it first so you can pinpoint the exact location where the pain is. Show doctor, doctor, I have pain here. Also mention if you have back pain, because with the pains I'm having, I had to get a supportive device to put when I'm sitting, because it affected even my lower back. No, I didn't have problems with my lower back, but the constant pain and strain, wear and tear affected even the back. So sometimes you have back pain, it's probably from the foot, you know, but you don't know. Remember, in every instance you use warm water. That's the old way of thinking, that you got to use Epsom salts. And listen to me, don't use anything unless you consult with your doctor. Sometimes ice is the best thing for swelling and inflammation, okay? But you won't know if somebody didn't tell you. Ask your doctor. Call up Dwayne Hendrickson or go and visit and ask. Tell him what's going on with your feet, okay? Don't take it for granted. January morning, I didn't take what happened to me for granted at all. I acted as soon as I could. As soon as I was able to, I acted on it, because I knew I needed to be here. I needed to be a mother. I needed to be a grandmother. I needed to be a nurse. I needed to be a wife. I needed to be everything that I was designed and brought here to be. And I couldn't do that effectively without my feet. So please remember that your feet, have happy feet. Make your feet glad, because they are taking you everywhere. They are with you all the time. And if they don't work, you would not be your effective holistic self. This topic is dear to my heart, because I have experienced the journey, and I am still basically on the journey. I have to go back to check on things. I have to go back to have surgery. But guess what? I am prepared mentally, physically now for my journey, my continued journey. I shouldn't have to take time out and off to deal with a matter that was already in front of me. Whether you're a professional or a regular person, any pain that is happening for too long should be addressed, because you don't know what it is, and you don't know the complications that pain could have on your well-being. My blood pressure is much more under control because I'm not in as much pain. And the walking can be difficult, especially steps and ramps, because I have to wear braces now. I am feeling like I want to run. You ever been in a situation where you never want to run until you can't? At this point I can't, but I want to so badly. You know why? Because I am energized enough now to go forward, and I'm so happy I can move without the discomfort and the pain that I feel like I want to run. And I don't mind that I can't. One day I might be able to again. So that's why you need to take care of you and put you first. Because that moment when I tried to get help in that first 5 to 10 minutes, January morning, and I couldn't get anyone because everybody was asleep, that was a wake-up call for me to please take care of me. And I did a series on self-care before, and I would like you to take a look at that again and incorporate the foot care with it. These feet are our precious possession. God gave it to us, gave them to us for a reason. We could not be contributing as we would like if we can't get to where we need to go. You understand? So it's important that we do the right thing and go and see a doctor tomorrow, whenever you see this broadcast, so you can also be loving on yourself. To take care of your feet is to love you. To take care of your spiritual needs is to love you. To take care of your, relaxation needs is to love you. It's all part of loving you. It's all part of progress, self, elevation. And it will make you happy along the way. And when you finish, you polish your toes. You make sure you get a pedicure. Because you have taken care of you. You have recognized there's something that needs to be addressed. And I thank you for the opportunity to bring awareness. I am very grateful and blessed to have to be here today to tell you my journey so that you can know it's not an accident. It's in alignment with things that I succumb. All that happens to a person, it makes them stronger if they choose that. And this has brought me to the point where I am not taking anything for granted at all anymore. I am not judging anymore. I am fixated on making things right. Because when you know better, you do better. Simple. You don't have to watch the crowd. You do better. You don't have to worry about what anybody else thinks and says. You just do better. So for me, it is a journey that brought me a little closer to my loved ones, a little closer to persons that really cared about me. It brought me closer to even myself. And of course, I give Jehovah all the thanks, because without him, I might not have been here to tell you today about self-awareness of foot pain. Please check your feet, get to a doctor, call 665-1900 if you need advice. And thank you for your time. And see you next time.